all know about the breast diseases. So how to diagnose a breast problem? We know there can be, breast can be all worried about the breast cancer, breast tumor. There are so many other things, secretion from the breast and all these things. So how to diagnose it? Most important, how will you know that you have got a breast problem? Most of the ladies, they come to us with a large tumor and they don't even know that they have got a tumor, because the bad part about the breast tumor is that it is most of the time painless. It's a very silent tumor. Even the cancer is also growing in the breast, which we see 5-6 centimeter tumor, puckering is there, skin involvement is there, gland is involved, but there is no symptom in the breast. That it doesn't cause pain. We generally go to a doctor when there is a pain or there is bleeding or something, but most of the time breast tumors present as painless tumor. So how to diagnose it? So most important thing, let me tell you the best part about that. A lady can most of the time diagnose, in 90% time a lady herself can diagnose that she's got a breast tumor. So how? Most thing is that do a self breast examination. If you got a tumor inside the abdomen or in the brain, in the chest or somewhere, it is very difficult for a person to know that you've got a tumor. But breast is actually very palpable. This is a superficial organ, and it is very easy for a person to just palpate and feel the lump. It can be even 2 centimeter, 3 centimeter lump can be felt by the patient. So most important thing, first go for regular breast self-examination. So how to do the self-breast examination? Most important, when to do the self-breast examination, from when to do the self-breast examination. Breast examination should start from puberty itself. The moment a girl starts developing her breast, a mother should teach. But all mothers should also know how to do the self-breast examination. Self-breast examination should start from then, when the breast is developing, because most of the tumor which we find in fibroadenomas or cysts are more common in the younger age group, and the girls, they don't even know they have got tumor. So self breast examination should be done when the breast is little supple. Premenstrual breast is little firm and tender. So always do the self breast examination when your period is over, 5 to 6 days from the period. The day of period starts 5 to 6 days. After that, best time is to, when you're taking bath, that time you can just lift your arm and you can feel when you're lathering yourself or putting the soap or something, or you can lying down also, you can, when you're sleeping, you can do. The most important thing, you have to feel the breast with the flat of your hand, not with the tip. Okay, you have to feel the breast with the flat of your hand, and you have to palpate all the quadrants and just behind the nipple and in the axilla. And if you feel any tumor, it's the most common is that if you feel that if you feel your hand here in the wrist and there is a bony hardness is there, that kind of a lump can be felt, is a firm lump, painless lump is felt. It can be a cyst, but it can be a tumor, but that can be felt by the patient. The right breast should be felt by the left hand, and the left breast should be felt by the right hand. So best time, as I told you, and the ladies who have stopped periods, like they've gone menopause, they've attained menopause, in that case, once a month, you should examine yourself. Just fix a date, like first week of and first Monday of any month or something like that. So that is the time when a menopause is attained. Then once a month you should examine yourself, and if you're having periods, then once the periods is getting over, that time you should do. It's very easy to feel your lump. Most of the time a lady feels a lump, and this is what you feel is a painless hard lump. Sometimes it is mobile and sometimes it is fixed, but whatever, and at the same time you try to feel the axilla, both the axilla, and you just feel the axilla. If you have any lump in the axilla, you find any lump, immediately contact the doctors and a specialist. That's all. I hope you have gained some knowledge about it, and you should do regular self breast examination. That will help you in finding your disease early. Thank you so much.